All right, so hello everyone, and welcome to this conference point from the the Montreal Public Health Regional Director and the STM, the Montreal Public Transport. I would like to remind you that, as always, this is being broadcast on Facebook of Santé Montréal. And also for journalists who are present over the phone, we do ask you to please keep your phone on mute, and please do not put your calls awaiting. So we're going to start with French, with Dr. Drouin, and then the mayor and Mr. Schnobb. And after that, there will be an English speech by all three people in the same order. I would like to remind all journalists to please keep your phones on mute. So, Dr. Mylène Drouin, the Montreal Public Health Regional Director. Hello, everyone. Good morning. Good Monday morning. Today, we're going to go over the situation for the Montreal region once again to talk about the deconfinement, but especially the regional strategy for the screening, populationally speaking. So, as of yesterday, we had 16,306 cases in Montreal. That's 355 new cases in the past 24 hours. So we can clearly see that we have a progression in the number of cases. We are not lowering the epidemic curve. 1,410 deaths. That's 45 new deaths in the past 24 hours, mainly once again linked to the CHSLD crisis and the numerous outbreaks that we have in CHSLDs and RPAs. Hospitalizations, we clearly see that we have a certain plateau in terms of the new admissions for COVID in hospital centers. But it is 1,055 people who are currently hospitalized in Montreal. Out of those, 137 in ICU. In the ICU, we do see a regression in the number of new admissions. So globally, the epidemiological situation, when we look at the numbers, we are not lowering the epidemic curve. We can see a plateau or even an increase in cases. The deconfinement was the subject of the day at our last press conference. We talked a little bit about the conditions for a safe and successful deconfinement. Those conditions are ones that we're working at very hard, so that we master community transmission, the capacity of public health be there to detect, isolate, and investigate any outbreaks, as well, of course, as the capacity of the health network to be able to be there if there is an increase in the number of cases, particularly the ones requiring hospitalization. Today, I wish to salute the decision of the Premier in Quebec to delay by 1 week the opening of businesses that have an external access. I believe that this extra week is going to allow us to document the potential transmission zones in the community, what we can see in certain places in certain areas, whether really there is something going on, and that it would explain the reason why we don't have a lowering of our epidemic curve, an honest lowering. And it will allow us to work at the setup of other essential measures so that working environments be ready to open safely for their employees as well as for the population. So the subject today that we wish to talk to you about, and that is why we have Mr. Schnobb with us from the STM, is really the regional strategy for screening. Last Friday, it was announced to us that we would take over again the screening system for the populational aspect. This is something that we had done in March pretty intensely to go get cases linked to people who were traveling back from the outside. After that, we concentrated with a capacity for screening hospital care centers, CHSLDs, RPAs, and that will be continuing, except that today, with the deconfinement, it's an essential condition to have that tool that will allow us to understand what is going on in our communities, and particularly to be able to quickly investigate our cases, isolate the contacts, and control outbreaks. So the groups that are going to be invited to get screened are, of course, the population that has symptoms that look like COVID-19. So, difficulty breathing, coughing, fever. The essential workers that already had symptoms were prioritized, but we continue including them. And slowly, we are also going to start including more targeted screening for certain places, working environments, or neighborhoods where we can see that there are outbreaks. And we are perhaps even going to go up to screening the contacts of cases that are confirmed. So that screening capacity for the population will be developed progressively over the next few days. Already in your neighborhoods, you have designated screening centers for which you can call through the 1-877 number to get an appointment in the upcoming days. What we would ask you, of course, if you have symptoms, is you must isolate yourself. You can make an appointment for a test. If you are unable to have it in the very day or the next day, remain isolated, and we will be able to offer you an appointment or send you to a walk-in clinic in the following days. What we are announcing today is also adding a new aspect to the strategy, the screening strategy, which is an initiative which is a fruit of collaborations together with the STM and the City of Montreal. And that is the setup of mobile units that will be able to move around in different neighborhoods with a weekly schedule to allow us to truly understand what is happening in those neighborhoods in terms of community transmission. The neighborhoods that we are targeting as a priority are the ones that we call the hot zones, which we target looking at new COVID-19 cases that have appeared in the past 14 days. So already we have a mapping that will allow us to see where it is that we wish to go. But to that, we will also be adding all the factors linked to the isolation of a neighborhood, geographically speaking, as well as the different barriers to the access to screening from certain populations, whether it be language, transportation, or any other constraints. These screening strategies and these mobile units will also come with steps to create awareness within the population to make sure that before we get there, that the community be aware that we're coming and that the population be able to know what they will have access to and that they will have access to screening more quickly. Together with our partners of the different environments, so the boroughs, the CIUs, the community centers from Montreal Nord and Saint-Michel, already this weekend there was solicitation and canvassing done and screening initiatives that were made in these neighborhoods, and it is using that model but more systematically that we are working on those mobile units that will take the shape probably of a bus in which people can come in to get screened and to get through the trajectory. I would also like to remind you that we have a lot of calls of people who want to get screened. They are asymptomatic and they say, my employer wants me to have a screening test so I can get back to work. This is not a screening test indication. Somebody who is asymptomatic should not go get screened. It is not a guarantee that that person is not in an incubation period and that within 2 days they wouldn't develop symptoms. So for us, clearly, we ask for work environments to not require those tests before a person can go back to work. So in the course of the next few days, on our website, we will be able to broadcast the schedule of this first mobile unit. And after that, we are, of course, going to be adding more. Of course, today and tomorrow, we are really preparing the logistics aspect of it. So setting up these buses, their setup. And tomorrow, together with patients, we will try to see how well they work to be able to deploy it at a larger scale over the week. To end with, I wish to remind everyone of the importance of social distancing measures. The spring is here, we had beautiful weather over the weekend, but in a deconfinement period, it is even more important to maintain that social distance, to avoid gatherings. The guidelines have not changed, even though the spring is here. And I would like to reiterate, and I would like to ask the population to wear face coverings. Thank you to all those who already wear it. You have to wear it when you are in places where you know that the 2 meters is more difficult to respect. Businesses, public transportation, and even in public external spaces. Sometimes there are parks like over the weekend that were very busy. Clearly, it's difficult to respect the distance at all times, so the face covering will have to become a habit to all Montrealers. Thank you to all those who are creating really all kinds of beautiful face coverings to make it more pleasant. So thank you to those artisans. I know that we want to go back to a normal life, but we really cannot stop our efforts. It really is truly with you that we'll be able to have a safe and successful deconfinement for the Montreal region. Thank you. Technical glitch. Amongst others, that mobile screening clinic that was deployed thanks to the work of the STM and public health, but also of the Coordination Center for Emergency Measures of the City of Montreal. And I think that it shows very good teamwork to find solutions where the needs are most pressing. So I would like to say, first of all, that the setup of these clinics really goes together in complementarity with the opening of a screening clinic in the Villeray-Saint-Michel-Parc-Extension borough and with the increase of the testing capacity in Montréal-Nord and Rivière-des-Prairies, which will allow to test 100 symptomatic people per day. As Dr. Drouin was mentioning, the mobile clinics will go to the sectors that need it, that require targeted interventions, and is added to the measures that have already been set up in certain more affected neighborhoods. I'm thinking, for example, Montréal-Nord, Saint-Michel, and Rivière-des-Prairies. And we will be able to visit one of these mobile units tomorrow, and you will be invited to do so as well. We really look forward to seeing how this will be concretely, but we're very satisfied with the efforts that have been deployed. And talking of efforts and talking about mobilization, I really wish to thank the citizen initiatives that have been set up in many neighborhoods. For example, Woodstock, which is an organization that distributed face coverings as well as information to the residents of Montréal-Nord over the weekend, and we are very proud at the City of Montreal to be able to support them to do so. So we know that in times of crisis, it's more important than ever to break the silos and collaborate together. And I would say that this is what we do as much as possible at the City of Montreal. We support our partners and the organizations as well that have a good understanding of on the field and that can find quick solutions to pressing problems. Now, I would like to get back to the situation over the weekend. Yes, it was beautiful. I think that it did us all a lot of good. I had said last week, it's good for our hearts, it's good for our souls. Montrealers went to the parks of the metropolis during the first true beautiful spring weekend. I would like to emit a reminder. The parks, for a lot of Montrealers, for families, and not just families, but very often it is the only way for the population to be able to take advantage of a bit of green. Not everybody has a backyard, not everybody has a balcony either. So that need of having some air is normal. That being said, we still have to make sure that the places are frequented in a responsible way by all Montrealers. And that is what we're able to see over the weekend with the help of the police forces, that the distance of the 2 meters was, generally speaking, respected. But still, there were a few gatherings, and I am there to remind everyone that although we are opening certain economic sectors, we are not deconfining everything. We are still in it, so we have to continue with distancing. We still can't gather. This is applicable in your yard, in the park, at the grocery store. It's applicable everywhere. So I would invite the population to respect the rules, and I'll never say it enough. When it is impossible to keep a distance of 2 meters, please wear a face covering in order to protect yourself and particularly protect others. over the weekend, taking into account that many parks were very busy, we decided on Saturday night to close the access, the parking lots of Maisonneuve, de la Visitation, Frédéric Park, Jarry, and Lafontaine parks. And as well, I wanted to remind you that the police services are there. They are very present. The police officers in the parks, and of course, they are there to have those rules respected. So the rule of not gathering is a real rule, and the police officers are there to make sure that it is enforced. Now, this being said, concerning the situation of the parks, I would still like to remind everyone and say that I am conscious of the fact that Montrealers need space. That's why I'm saying you have to wear a mask, because with the best will in the world, it's not always too easy to respect the 2 meters. And that is why already 2 weeks ago, or even 3 weeks ago, we started setting up a sanitary corridors in collaboration with the boroughs who wish to have them, and that allowed to ease being able to move around. Over the weekend, we went further. We tested the first family active rules in the Plateau Mont-Royal area. And those initiatives have an objective to give space to the numerous pedestrians to allow for social distancing. And I can tell you that that kind of initiative is going to become even broader in the next few days in many boroughs of the city. For those who don't know what that is, when we talk about a family and active street, it's a local street on which only local authorization or local circulation is allowed. So that road belongs to everyone equally. That is to say that cars can use them, bikers can use them, and pedestrians, but especially pedestrians, we want to encourage people to use them. So we invite you to do so, and we invite everyone, of course, to respect the signaling, to remind you that when you are on a family active road, what that means that everyone is equal in the street. And finally, I would like to mention a vast plan of urban setup, and the purpose of that summer plan is to give back room to pedestrians and bikers and to give a hand to business owners who will need space to allow them to continue with their operations. So we're working very hard to offer enough space to people who are moving around, of course. I therefore expect for Montrealers to continue respecting the rules of social distancing rigorously. Now, as Dr. Drouin was mentioning earlier on, I also heard the call out of the Premier earlier on, who announced the date for reopening of businesses, retail businesses, that was changed by a week. That is a decision that I fully support, since it will allow us to continue with our preparatory work and to ensure that the conditions are either optimal for the reopening of certain economic sectors, as well as the reopening of primary schools and daycares. So we go and talk with our partners every day, with our partners of public health and the provincial government, to really follow the evolution of the situation. The battle has not been won in Montreal, but we must continue the fight, and we give ourselves all the necessary means to get to there. And what I can say is that, this being said, if the decision had to be made by public health and the government of Quebec to delay certain reopenings of other sectors, of course, we will listen to this, and we will be following the recommendations emitted without any problems. I already talked about the face covering, so I think that I know that I'm talking about it a lot, because I really wish for Montrealers to be able to incorporate this into their habits, face coverings, to really make sure that this summer we be able to take advantage of the beautiful days while being protected and in protecting others. So thank you very much. Mr. Schnobb? Yes, Madam Mayor, thank you. And Dr. Drouin, thank you for welcoming me here. The STM is very happy to associate itself to this initiative from the public health authorities and the City of Montreal, deploying buses for the setup of these mobile clinics. I'll explain to you a little bit how it is that we're going to be working on our end. So every morning, a driver from the STM is going to go and drive the bus to the place that the public health authorities will have told us, and at the end of the day, the drivers will also take the bus back. But before then, the bus will have been disinfected by the authorities. It's very important to mention it, because I understand that some drivers may be worried to have to move those buses. And I'm also saying it for, our all of our employees. They will have been disinfected. I want to, mention that, because the health and safety of our employees and our clients is at the very heart of our preoccupation. So I wish to thank the STM teams that managed to make this initiative possible in very little time. They talked to me on Thursday afternoon, and it's Monday afternoon, and we've done it. And in public transportation, it's rare that we can fix things in 3.5 days, but we managed to do it, and I salute the agility of our teams that managed to do it. And it's in great part thanks to the fact that for almost 2 months now, we are in almost daily communication with the public health authorities and the Centre for Coordination of Emergency Measures. That is what allows us to make these initiatives very quickly, while ensuring, of course, that there is coherence in our actions. So we're talking about deconfinement, and that will come eventually. We are preparing ourselves at the STM. There's an entire plan that we are setting up. We are, tweaking a few details, but I wish to assure people that we'll be able to give the general idea of our deconfinement plans by the end of the week, so that our employees and clients be able to prepare themselves adequately. And I thank you. Thank you. English.
So for today, the Montreal situation, we have more than 16,000 new cases confirmed, and it is 355 new cases in the last 24 hours. It is more than 1,410 deaths, and 45 of them in the last 24 hours. Most of them are in CHSLD and elder residency. We're seeing a plateau in the number of new admissions in hospitals for COVID-19, and a decrease in the number of new admissions for intensive care units. So this is positive aspects of our data, but at the same time, globally, we're not seeing a decrease or in the curve, in the epidemiological curve. We've been talking about a reopening of different sectors and what are the conditions that we have to put in place to make sure that it is done securely and that we make it a success for Montreal. We know that some of those conditions are not all in place at the time we're speaking, and one of them was we had some questions on for which, if we had some local transmissions, sustained transmission in some neighborhoods. At this time, I want to say that I am really happy to see the decision of the Quebec government to delay of 1 week the reopening of some commercial sectors. I think it's going to give us the time to see if we have specific outbreaks or sustained transmission in some neighborhoods where we have to intervene first, and to make sure that all the other conditions are in place, including the preparation of those workplace. Today we wanted to talk a little bit more, and we have STM that is with us with the Ville de Montréal today to announce the regional strategy for testing. We know that testing is one of the conditions for a successful deconfinement. And last Friday, the government of Quebec said that we would reopen testing to the general population. What this means is not everyone that's going to be tested. It's really the persons that have, people that have symptoms like COVID-like symptoms, like a cough, dyspnea, difficulty breathing, or temperature. Of course, essential workers that have symptoms. And we're going to also start test in specific places where we have outbreaks, or maybe testing some contacts of cases. So generally, the population has access now to the CDD, the centers for testing that are in place in Montreal. If people want to have a rendezvous, or some of those places are without rendezvous. Appointment. They can call the 1-877 line. But what we are announcing today is an initiative that we've built in collaboration with STM and Ville de Montréal, and we're adding to our strategy mobile units that are going to go in different neighborhoods, specifically hotspots that we are going to define each week. Those hotspots are going to be measured with the indicator of new cases in the last 14 days. And we're also going to go in neighborhoods also where we know that we have specific barriers to access for testing, language, specific communities that we have difficulty to reach. I want to finish by saying that where we are, even if spring is coming and we have good weather and we want to go out, I think we all have to maintain the 2-meter distance. We have to avoid gatherings. It is really important that the population stay mobilized with the public health recommendations. And of course, as we said last week, we do recommend that the population wear face covers when they go in public places, and mainly when it is difficult to respect the 2 meters distance with others, like in public transportation, grocery stores, pharmacy, or even in parks. As we saw this weekend, there was lots of people in the parks, and sometimes it is not easy to maintain the 2-meter distance. So we really ask the population to start wearing those cover masks. And we want to thank all the artisans that are making those masks with different fabrics to make it happier. So thank you everyone for being part of this, the solution for the success of the deconfinement for Montreal. Thank you.
Thank you very much. So I'm really happy that the City of Montreal has been able to support the work of the public health authorities in the deployment of mobile screening clinics, and of course with the help as well of the STM. And I think it shows that when we all work together, we find very concrete solutions. And I definitely want to thank all the teams at the Emergency Measures Control Center of the City of Montreal that have been very supportive as well to implement those mobile clinics. So I just want to reiterate that these new clinics, mobile clinics, will work in conjunction with the opening of the screening clinics in the boroughs of Villeray, Saint-Michel par extension. And the mobile clinics are in addition to the increased testing capacity in Montréal-Nord and Rivière-des-Prairies, which will allow testing of 100 symptomatic people per day. And as Dr. Drouin mentioned, the mobile clinics will be deployed in sectors that require targeted intervention. They will complement the measures that are already in place in some of the most affected neighborhoods, for example, in Montréal-Nord, Saint-Michel, and Rivière-des-Prairies. I would also like to salute the citizens' initiative started in these neighborhoods. I was saying earlier that it's in time of crisis, it's time to think outside of the box and to support people that have great ideas and good intention. And this is what we saw last weekend with the organization called Hoodstock. And what they did is they started to distribute face coverings and information to the residents of Montréal-Nord, and the City of Montreal is very happy to support them to do so. Now I want to come back to the situation of the last weekend. It was a beautiful weekend, and definitely Montrealers were excited about enjoying a bit of that beautiful weather. So we know that a lot of Montrealers did visit cities' parks during our first real spring weekend. And I want us to keep an open mind and to keep in mind actually that for many people in this city who don't have a backyard, who don't have a balcony, who used to, go to restaurants and cafes to enjoy a bit of time outside their house or actually outside their apartments, that parks is very important for their health. So I do want to say that we're putting everything together so we keep them open. It is very important to me. So though the majority of people were actually respecting the 2 meters distance, we also noticed that the demand for parks was pretty important, was pretty huge this weekend. So we needed to take some action, and this is why on Saturday we closed the parking lots of these parks. I'm thinking about le parc Lafontaine, le parc Maisonneuve, le parc Jarry, celui de la Visitation, et enfin le parc Frédéric Bach. That being said, I understand the need for people, for Montrealers to go out and to walk outside in a safe way. So this is why we decided to create safety corridors started 3 weeks ago in collaboration with the boroughs that have requested it. And this weekend, we started a new initiative called the Family Friendly and Active Streets. And we started some of those streets, family friendly and active in Plateau Mont-Royal. And the goal of those streets is really to give more space for pedestrians and to allow a better social distancing. We expect to have more of those. That's our goal. So again, we can better support Montrealers in their need to go out, but again, in a safe way. Finally, I will be announcing a vast urban transportation plan to give space back to pedestrians and cyclists. I call it my urban transportation plan for summer, and it will give more space for pedestrians and cyclists, in addition to giving a hand to merchants who will eventually need space as well to continue their operation, and we want to support them. So the city is working very hard to provide more room for people to get around. So I expect Montrealers to continue respecting the rules of distancing in a disciplined manner. So, and I also want to say that during the weekend, and it will continue that way, police officers will continue their patrols to ensure that these rules are respected. And of course, those rules are the same, no gathering whatsoever, keeping your 2 meters distance, and wear your face covering when it's difficult to keep your 2 meters distance, which is quite often the case in Montreal. Finally, as announced by the Premier of Quebec, the date for reporting retail businesses in the metropolitan area will be extended by a week. And I do want to say that I support this decision, and it will allow us to carry on with our preparation to ensure that conditions are optimal when we reopen some sectors as well as schools. We will continue speaking with our partners in the provincial government and the public health authorities on a daily basis to monitor the situation as it unfolds. So though the battle is not over in Montreal, I want to say that we were continuing the fight. We are thinking outside the box. We're putting all the pieces together, or at least all the efforts and energy together so we have a better, so we can go through this as fast as possible, but of course in a safe way for all of our population. Thank you. Mr. Schnobb?
Merci, Madame la Mairesse. Alors, the STM is very proud to collaborate with the Public Health Authority to make possible the deployment of these mobile units. You talk about thinking outside of the box. I think it's a good example of that.
So the interpreter apologizes. We're having a technical glitch. We ask you for patience as we fix it. Thank you. So once again, our apologies. We are working on the technical glitch. Once again, we wish to apologize and ask for your patience as we work through a technical glitch.
Dr. Drouin, serait-il envisageable de présenter des galas de boxe
Would you consider giving galas at the Casino of Montreal in camera before the opening of this one? The interpreter missed the context. Well, we talked about galas in the month of March, if I recall, mid-March. Clearly, this is the entire question of sports, not only of sports, but the technical platforms, the opening of certain aspects of the parks, the pools, etc. Right now, what we are doing is really an analysis grid for the analysis of risks, which first will allow us to be equitable and see under which conditions we'll be able to reopen these events or these infrastructures that right now, is not something that we've concentrated. Right now, the government is concentrating on the economic recovery. But all the social cultural deconfinement, as I like to call it, is also going to have an aspect for which we are working on the grid analyses for the risks to be able to make those decisions. We will now be going to English questions. Once again, we reiterate we had to call the phone lines because we had a sound feedback. A question in English now.
To both of you, the Premier has pushed businesses reopening back an extra week in the Montreal area. How confident are you that this is enough time? And what about schools and daycare?
But I think it gives us the time this week and next week to make sure that we're starting testing in the population and that we increase our capacity for public health and for the healthcare system to a reopening of certain sectors that can bring more cases and some outbreaks. So I think it gives us the time to prepare ourselves, but we'll see next week if with the data that we have and with the work that we've done to increase our capacity, if we are able to reopen and in a secure manner.
Well, I mean, I approve of the decision of the Premier. I think it's going to give us more time, as Dr. Drouin said, to have a better understanding of some of the places where it's more difficult, or at least we don't have enough information. So to me, it's also a great opportunity to prepare all the things that needs to be ready for the reopening of certain economic sectors as well as schools.
Et dernière question en anglais.
Last question in English as well.
Madame la mairesse Valérie Plante, Madame Plante, now that the Quebec government has pushed back the reopening of businesses in Montreal by 1 week, how will the continued closures affect Montreal's economy, and what other measures will the City of Montreal have to take in addition to the compressions you have already announced?
Oh, it's too early for me to say what will be the impact on the finances. And I think we've already showed our goodwill in making adjustment. But I mean, at this point, it is a situation where it's not Montreal's fault, right? We're doing everything we can. Everybody respects the rules, but hey, it's a virus that is deciding for us right now. So it is way too early to make to change our kind of scenarios, but it will definitely have a negative impact. But ultimately, for me, what's the most important thing is the health of the population.
Une dernière question de Madame Scott, toujours pour Madame Plante.
And one last question.
For Montrealers, if and when playgrounds, recreation centers, libraries, day camps, and other facilities will reopen, and what conditions will have to be present for you to reopen them?
So as I shared a lot of information on this last week, every decision connected to all the activities for our population needs to be studied and approved by the public health authorities, and from there we will share the different protocols and what will be open or not. But this is something we'll be sharing in the next coming weeks. But there has to be a level of an extra level of precaution, and that's why we're working very closely with the public health authorities.
Merci, Madame Plante. Merci, Monsieur Schnobb.
Thank you, Madame Plante, Mr. Schnobb, and Dr. Drouin. This puts an end to our press conference. Thank you and have a good day.
Tu as beaucoup de questions, toi, que finalement...
Là, je vais appeler le 98.
C'est toujours ça, hein?
Je vais encore une fois m'adresser à eux pour
C'est
leur
un peu
dire
plate parce qu'ils coupent les autres.
c'est ça. Mais moi, ça fait mon bonheur parce que, je veux dire, c'est tout à fait mon bonheur, mais on l'a dit.
Non, non.
Ou eux, tu pourrais leur dire qu'ils...